Hello, my colleagues. A very warm welcome. Let's practice some questions relating to early pregnancy module, molar pregnancy. In this question, you've got a woman who's had a surgical management for a missed miscarriage. The histopathology later reports a molar pregnancy. What is the most appropriate next step? Let's look at the option one by one. The first one, refer to specialized center. It's a bit vague. It doesn't exactly say where. The second option, refer to regional trophoblastic disease center. As the correct answer, we do refer them to such center, and we've got three centers here in UK, one in London, second in Dundee, and third in Sheffield. The third option, discharge the patient. We don't want to discharge the patient straight away. We don't want to keep following her up with the HCG levels. The fourth option, routine follow-up in 6 weeks. We definitely want to follow her up on a weekly basis with HCG levels, making it an incorrect option. The fifth one, check HCG levels. We do follow her up with the HCG levels, but it's a bit incomplete answer. It doesn't exactly say the frequency of monitoring with the HCG levels. Moving on to question number 2. We've got a 24-year-old woman who recently underwent evacuation for a complete molar pregnancy. She asked which contraception she can use whilst HCG follow-up continues. She's basically under HCG surveillance. So first option, avoid all hormonal contraception. That's incorrect because we do offer all forms of hormonal contraception, including emergency contraception. The only contraception that we don't want to offer is any form of intrauterine contraceptive device. Why? Because of the risk of perforation. Hence, option 2, offer combined hormonal contraception is the correct option. The rest of the option, including option 3, advise copper IUD. Option 4, no contraception restriction. Option 5, advise Mirena coil, are all incorrect. Let's move on to the next question. We've got a 29-year-old woman who had a complete molar pregnancy. Her HCG has returned to normal in 6 weeks. What is the next step? Option 1, no further follow-up needed. Definitely the incorrect option because here, even after the HCG normalizes, we continue to follow them for further 6 months. Option 2, continue weekly HCG until 8 weeks. That's again an incorrect option because we do follow up HCG on a weekly basis until it normalizes. And once it normalizes, we follow them up for a further 6 months. Option 3, continue HCG surveillance for 6 months from the date of uterine evacuation. That's the correct answer because here the HCG has returned to normal within 56 days. So we continue for further 6 months from the date of the procedure. Option 4, stop monitoring after 2 normal readings. That's again incorrect because once it normalizes, we continue to follow up for further 6 months. Option 5, continue HCG surveillance for 6 months from the date of normalization. That's again incorrect in this particular scenario. Why? Because the HCG has returned to normal within 56 days. If it takes more than 56 days to normalize, in that case, we continue the HCG surveillance for 6 months from the date it becomes normal. Thank you and have a good day.